Bismillahirrahmanirrahim. Quote of the day is all our dreams can come true if we have the courage to pursue them. Assalamualaikum everyone. I'm Dr. Shajia Javed, PGI Community Medicine, and I'm going to present the topic of study design under the supervision of Professor Dr. Saira Afzal. Learning outlines. In today's session, we will have an introduction of study design, see what are the different types of study design, including descriptive, observational, experimental, meta-analysis, and systematic review. We will see what are the factors which influence the study design and why it is important to choose the right study design. Overview of statistical techniques which are basically used in the study design, use of AI in study designs, ethical considerations, and at the end there will be MCQs. Planning outcomes. By the end of this presentation, the participants will understand what is study design and what are the different types of study design, the importance of the correct study design in research, learn about the statistical methods which are used in these designs, recognize the strengths and limitations of various study designs, and explore how AI is transforming research methodologies. Now let's start with the introduction of study design. Study designs are the structured methodologies which are used in research to collect and analyze the data systematically in a particular research problem. The purpose of the study design, they help researchers answer research questions effectively and they ensures accuracy and reliability. Importance of appropriate study designs. Why study design matter? Because they ensure valid results, they enhance accuracy, they improve ethical standards, they optimize the resource use, they strengthen the evidence-based practice, they enhance reproducibility, maximize generalizability, facilitate regulatory approval and sports policy and the public health decisions. The classification of the study design, several classifications of the study types are available in the medical literature, but broad classification suggested by WHO is observational studies and non-interventional studies, and the second one is experimental or interventional studies. Observational studies of the non-interventional are the one in which the researchers observe variables without any intervention, while in the experimental one, researchers manipulate the variables to establish the cause and effect relationships. Let's discuss them one by one in detail. Observation studies. These are the designs or the research methods which are used to study the behavior, events, or the condition without direct manipulation by the researcher. These designs allow the researchers to observe subjects in their natural setting, making them useful for studying real world behaviors and interactions. They are furtherly classified into the two types descriptive studies and analytical studies. Descriptive studies they focus on the characteristics, including case reports and the case series, while the analytical one focus on the relationship between the factors and they include case control, cross sections, or the cohort studies. Introduction to descriptive studies. A non-analytic or descriptive study is a research design which is used to describe the characteristics, behavior, trends, or pattern in a population without manipulating the variables. It does not try to quantify the relationship, but try to give us a picture of what is happening in a population, like the prevalence, incidence, or the experience of a group. Descriptive studies include case reports, case series, qualitative studies, and surveys, and for larger population, cross-sectional studies. Now, case report is a detailed account of a single case, while a case series is a collection of reports on the multiple patients with a similar condition. For example, if a doctor reports a unique side effect of a new COVID vaccine in one patient, it is considered a case report. While if a hospital documents 10 cases of a rare antibiotic resistant infection in ICU patient, it is a study which is describing multiple patients with a similar condition or treatment outcome. It is called case series. The strengths include they are simple and cost effective. They help generate hypotheses for the further research. They are useful for identifying the trends and patterns in a larger population. The limitations include they cannot establish the cause and effect relationship. They have a potential for bias in the data collection and interpretation. They may not provide the deep insights into the underlying reasons for behavior as they have no control group. Analytical studies. An analytical study attempt to quantify the relationship between two factors and focus on identifying the association between the risk factors and the outcome. That is the effect of an intervention on an exposure or an outcome. They help to determine the potential causes of a disease and they include case control studies, cohort studies, and cross-sectional studies. First, we will see the cross-sectional studies. Cross-sectional studies measure exposure and outcome at a single point in time. These studies quantify the burden of a disease in a given population and are useful for the generation of hypotheses. Cross-section studies cover a sample of population. If they cover the entire population, it's called census. The strengths of the cross-section includes They are quick, inexpensive, and they're good for the public health assessment. While their limitations are they cannot accept the causality and they're susceptible to recall and selection biases. Cross-section studies snapshot and what point in the time. For example, if a hospital surveys 1,000 adults in a city to determine the prevalence of the hypertension and its association with obesity, or the researchers who measure the blood pressure and BMI in all the participants at the same time without the follow. The cross-section studies exist only one point at a time, and it basically measures the population with disease and no disease. Second one is case control studies. A case control study is a type of study which is used to identify the factor that may contribute to a specific outcome, such as a disease. It is retrospective, meaning the researchers look back in the time to compare individuals with a particular condition, cases, to those who are without it, controls. The strengths include the efficient for studying rare diseases, cost effective and quick, requires few participants compared to the cohort studies. While the limitations are they are prone to the recall bias, selection bias, and they cannot establish causality. The methodology to conduct a case control studies include first we have to define the cases and control, select the individual who have the disease, they are called as cases, and those who are without the disease are called as controls. Now match the controls, ensure controls are similar to cases in terms of the key factor like age, gender, etc., but they do not have the disease. Assess the exposure, collect data on the past exposure for the potential risk factors, and then analyze the data. Use statistical methods like odds ratio to determine the relationship between the exposure and the disease. Example, the link between tobacco smoking and a lung cancer is one of the most significant finds of the case control study, which was the demonstration of the link between tobacco and smoking. And it is done by the Richard Roll and Bradford Hill. They show a statistically significant association in a large case control study. This graph summarizes the case control study. First, we define the cases in which the outcome was present and the controls without the outcome, and we will see if the exposure was present or not. Third one is a cohort studies. A cohort study is used to investigate the relationship between exposure and outcome. Participants are divided into groups based upon the exposure status, like exposed versus non-exposed. Researchers track the participants to observe whether they develop the outcome of interest. It uses relative risk to measure the likelihood of developing the outcome. The strengths include it provides strong evidence, it establishes the temporal relationship between exposure and the disease, it measures incidences, new cases of the disease, and it is less prone to recall bias. While the limitations include it is time consuming, expensive, and the loss to follow up can introduce a bias. Methodology to conduct a cohort studies include identifying the population of interest, select a group free of the disease at the start, classify the exposure, divide the participants into exposed and the non-exposed group, follow, monitor the participants over time to track the disease occurrence, compare outcome, measure the incidence of the disease in both the group, and analyze the risk, calculate the relative risk to assess the strength of the association. Types of cohort studies. It includes prospective cohort and the retrospective cohort. Prospective cohort is in which the data is collected in the real time. It begins in the present and follows the participants into the future. For example, following a group of smokers and non-smokers for 20 years to see who will develop the lung cancer. And the retrospective cohort uses the past data to identify the exposure and follows up using the records. For example, reviewing hospital records from the past 10 years to assess whether exposure to the asbestos lead towards a lung cancer. Cohort study real world example is the Framingham Heart Study, which is the one of the most well known cohort studies in the medical research. It began in 1948 in USA to investigate the risk factors for the cardiovascular diseases. It followed the participants over decades to study the cardiovascular risk factors. The key findings the Framingham study helped identify the major risk factors for the heart disease, including high blood pressure, high cholesterol levels, smoking, and obesity. Now, snapshot temporal design of the observation studies. If the study is done in the present, it's a cross-section studies. If we start from the present and move towards the future, it's the prospective cohort studies. But if we move back towards a part, it is retrospective cohort studies and the case control studies. Now, let's move towards experimental studies. Experimental studies are research methods where the investigators actively manipulate one or more variables to observe their effect on an outcome. Their purpose is to establish the cause and effect relationship. Type of the experimental studies include randomized controlled trial, quasi-experimental studies, and the clinical trials. A randomized controlled trial or RCTs is a type of experimental study which is used to evaluate the effectiveness of an intervention by randomly assigning the participants to different groups. It is a gold standard for determining the causality in research. Their strength include reduces the bias through randomization and blinding. It provides a high quality and generalizable results. The limitations include it is expensive and time consuming, the ethical concerns if withholding the treatment from a control group, and it requires large samples for the reliable results. The methodology to conduct RCT includes first, we have to define a research question and recruit the participants. Then, the second step and most important is randomization. Participants are randomly assigned to either the intervention group who receive the treatment or to the control group who are receiving no treatment or on a placebo. Then blinding is done. It can be single blind, in which the participants do not know which group they are in. And it can be a double blind. Neither the participants nor the researchers know the group assignments. It reduces the bias. Now, intervention is done, the experimental treatment or the procedure being tested, and outcome measurement is done. The effect of the intervention is measured using predefined criteria. Example include testing a new diabetic drug by randomly assigning the patients to receive either the drug or a placebo and comparing the blood sugar level after the 6 months. This shows that we have a sample population in which we done randomization and then it is allocated either to a control group or either to the effect group to see the outcome of the intervention. Types of the RCT. Parallel RCTs. The participants are randomly assigned to one or more groups, and each group receives a different treatment simultaneously. For example, we are doing a study comparing drug A and B for treating the hypertension. One group will get the drug A, and the other group will get the drug B, and their blood pressure is measured over the 6 months. In crossover RCTs, participants receive both the treatments at a different time point, but with a washout period in between to remove the effect of the first treatment. For example, a trial is done on the migraine medication where the participants receive medication X for 2 weeks. Then there's a washout period, and the medication Y is given for another 2 weeks. The migraine frequency is compared between the treatments. Cluster RCTs. Instead of individuals, entire group or clusters are randomized to a different intervention. For example, hospitals in the different regions are randomly assigned to either a new hand hygiene training program or a standard infection control practices, and the rate of the hospital-acquired infection is compared. Factorial RCTs. It tests two or more interventions simultaneously to assess their individual and combined effect. For example, a study is done on the diabetic management where participants are assigned to one of four groups. One with a diet change only, exercise only, both diet and exercise, or no intervention of the control group. And then the impact on the blood sugar control is measured. Quasi-experimental studies. A quasi-experimental design is a research method that resembles an experimental studies, but it lacks at least one character of a true experiment, like either randomization or a use of a separate control group. The strengths include it is more practicable and feasible than RCTs. It is useful when randomization is not possible or unethical. The limitations include high risk of the bias because of the lack of the randomization, harder to establish the causality as compared to the RCTs, and the confounding variables may influence the results. Clinical trial. A clinical trial is a research study which is conducted on a human participants to evaluate the safety, effectiveness, and side effects of the new drugs, treatments, medical devices, and intervention. The importance of the clinical trials include it helps us develop new treatment and improve the existing one. It ensures drug safety and effectiveness. It helps in disease prevention and public health advancements. Stages of the clinical trial. After years of the lab studies in the preclinical, there are furtherly four stages of the clinical trial. The phase one is safety and dosage testing. It tests safety and side effects and dosage, and participants are 22 healthy volunteers or the patients. In the phase two, efficacy and safety evaluation is done. It furtherly evaluates effectiveness and safety, and it includes 100 to 300 patients. The phase three is larger scale confirmation, which confirms effectiveness towards a larger population of around 1,000 to 3,000 patients. And the phase four is a post marketing surveillance, which monitors long term effects after the approval and includes thousands of the patients. Now, a clinical trial is done in the hospital and the clinic to test the new treatments of patient under the control condition. For example, testing a new cancer drug in a hospital patient, while the field trial is done on the general population. Its purpose is to evaluate the preventive measures in healthy individual. For example, polio vaccine trial in the school children. And a community trial is done on the entire community. It assesses the large-scale interventions for the purpose of the public health. For example, city-wide water fluoridation to reduce the cavities. This is a brief summary of the study design. Study designs on the basis of the intervention. We have divided them into the observation experiment. If the no intervention is done, we said that it is the observation study. If the comparison is present, then it will be descriptive studies, including the case report, case series, or the cross-section studies. Other option was the analytical studies, which on the basis of the direction can be divided into further three classes. If the exposure and outcome are measured at the same time, it is called as cross-sectional studies. If we move from outcome back towards the exposure, it's case control study. Or if we move from exposure towards the outcome, it is cohort study. On the other hand, if intervention was done, it was an experimental studies. The experimental studies include clinical trial randomized on a non-randomized crossover, community trials, and the field trials. Now let's compare observation experimental studies. In observation studies, causality is less, while experimental studies, causality is present. The ethical concerns are lower in observation studies, but they are higher in experimental studies. The observation studies are cost effective, while the experimental studies have higher cost. Observation studies have the higher chances of the bias, while the experimental studies have low chances of the bias. In observation studies, control over variables is very low, but in experimental studies, control over the variables is high. The role of the systematic reviews and the meta-analysis. Systematic review is a structured summary of the multiple research studies that address a specific research question. It follows a rigorous and a predefined methodology to minimize the bias. For example, we are reviewing the 10 studies on COVID-19 vaccine to assess their overall effectiveness. While meta-analysis is a statistical technique that combines the data from the multiple studies to derive a single quantitative estimation of an effect. For example, we are combining the data from the 15 trials to determine whether aspirin reduces the risk of stroke. The advantages include they reduces the bias by systematically selecting studies, they increase statistical power by combining the data, they provide reliable evidence for clinical and policy decisions. The limitations include they are limited by the quality of included studies, they are prone to publication bias, for example, positive results are more likely to get published, and heterogeneity in the study design can affect the results. The process of conducting a systematic review and meta-analysis include first we have to define a research question using the framework like PICO, which include the population, intervention, comparison, and outcome. The second one is search and select the studies, identifying the studies through the databases like PubMed, Cochrane Library, or Scopus. The data extraction is the third step in which gather the relevant data from the selected studies. Quality assessment by the tools like Cochrane Risk of the Bias tool to assess the study reliability and data synthesis. If the qualitative synthesis systematic review is done, it summarizes the key finding. In the quantitative synthesis or meta-analysis, we use statistical models to combine the results. We will have now a brief overview of the statistical methods which are used in different study design. In descriptive studies, mostly we are using mean, median, standard deviation, prevalence, and percentages. In cohort study, the key statistical method used are the relative risk, chi-square, or the regression analysis. In case control study, odds ratio, chi-square, and logistic regression is used. Randomized control trial and experimental studies include t-test, ANOVA, Kaplan-Meier, p-value, and a confidence interval, while in meta-analysis, forest plot, heterogeneity test, and the fixed random effects are used. The hierarchy of the study types. The research study follows a hierarchy based upon the level of the evidence they provide. The hierarchy starts from the weakest to strongest. The weakest or the lowest level of the evidence is provided by the descriptive studies, followed by the observational studies, which provide the moderate level of evidence. Then the experimental studies provide the high evidence, and systematic review and the meta-analysis provide the highest level of the evidence. Now, the factors which influence the choice of the study design. The study design depends upon the research objective and the question. We have to determine whether the study is observational or experimental. Ethical consideration to ensure the patient safety and avoiding the harm. Availability of the resources, budget, time, and personal affect the feasibility. Study population and the sample size. Availability of the participants influence the choice of the design. Disease frequency and rarity. Rare disease often favor case control studies and the common conditions suit cohort studies. Data availability. Existing records favor the retrospective studies, while the new data collection allows for the prospective studies, and the follow-up duration. Long-term effects require cohort studies, while the short-term effects can be measured by the cross-sectional studies. Ethical consideration in study design. We have to consider the informed consents. Participants must be fully informed before participation. Confidentiality and privacy should be maintained. The physical, psychological, social harm should be minimized. Scientific integrity and honesty should be done. Fair participant selection should be done to avoid any kind of the bias. Equitable distribution of risk and benefits in the research. Independent ethical review boards to obtain approvals. The rights to withdraw participants can leave the study anytime without any consequences, and transparency and the conflict of the interest disclosure to report any financial or personal interest. Challenges and common mistakes in study design. Poor research question, vague or unconfused objective can lead towards unclear outcomes. Inappropriate study design, choosing a design that do not match the research question. Selection bias, non-random or unrepresentative selection affects the validity. Small sample size, which may be inadequate, and it reduces the reliability of the results. Confounding variables, failure to control the external factors can affect the outcome. Lack of the randomization in the case of the experimental studies will result into the biased results. An improper blinding, the lack of the blinding increases observer or the participant's biases. How AI influences the study design. AI has resulted into the automated data collection, which AI streamlined data gathering processes from electronic health records, variables, and images. Enhanced data analysis, AI detect the patterns and trends in the large data sets, improving the study efficacy. Predictive modeling, AI forecasts the disease progression and patient outcome, aiding study design. Optimize patient selection. AI identifies a suitable participants for the clinical trials and reduces the bias. And adaptive trial design. AI allow the real-time adjustment in the clinical trials based upon the interim results. Revolutionizing the clinical trials, the role of AI in accelerating the medical breakthrough. Clinical trials are the essential assessment for the safe, reliable, and the effective drug treatment. The clinical trials are time-consuming process with the patient recruitment, enrollment, frequent monitoring, and the medical adherence and retention. With the AI-powered tool, and automated data can be generated and managed in the trial lifecycle. AI can intelligently interpret the data, feed downstream systems, and automatically fill out the injured analysis report. It has revolutionized the innovative way of collecting data, biosimulation, and early data diagnosis for the clinical trials, and overcome the challenges more precisely through the cost and time reduction, improve efficiency, and improve the drug development research with the less need of the work. It shows that the clinical trials are the key evaluation for the development of the safe, dependable, and effective therapeutics. By collecting data in a way that enhances the equipment, adherence, and data analysis, AI has a potential to accelerate the trial cycles and the patient outcome. AI can automatically fill up the necessary analysis report and intelligently interpret the data to feed downstream signals. Data right? It will reduce the population heterogeneity. They have a prognostic enrichment and predictive enrichment. Machine learning can be applied to and analyze and interpret multiple data sources, including electronic health records, images, and omics. The advantages and limitation of using the AI in the clinical trial. AI can transform the key steps of the clinical trial, study preparation to execution, and improve trial success. It can improve patient equipment, protocol designs, and trial success. It can monitor patient and analyze the data. It can predict clinical outcomes and help the healthcare professional to betterly understand the patterns by doing the in-depth analysis. While the limitations include, it requires significant investment in technology and infrastructure. It requires specialized expertise in both clinical and machine learning. It raises ethical concerns and data privacy. The lack of the empirical data validating the effectiveness of AI-based medicine in planned clinical trial is the main obstacle to the successful deployment. Now we will have some MCQs. MCQs number one. A researcher investigates whether smoking is linked to lung cancer by comparing the past smoking habits of individuals with a lung cancer to those who are without it. What type of study design is he using? A. Cross-sectional study. B. Case control study. C. Cohort. D. Randomized control trial. And E. Descriptive study.
B.
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 Yes, the answer is B. Question number two. A survey is conducted among 2,000 people of Lahore city to determine the prevalence of obesity at a given time. What design does study represent? A. Case control. B. Cohort. C. Cross-sectional. D. Experimental. And E. Meta-analysis.
C. Cross section.
C.
It's a cross-sectional study. C. Number third, a pharmaceutical company randomly assigns the patients to either receive a new diabetic drug or placebo and tracks their blood sugar level over 6 months. The study design being used is quasi-experimental, B. Case control, C. Randomized control trial, D. Cohort, or E. Cross-sectional study.
Randomized control trial.
RCT.
It's an RCT. 4. Doctors at a district hospital publish a report detailing an unusual new incident found in 3 patients. What study design is this? A. Case report. B. Cohort. C. Meta-analysis. D. Case control. E. Experimental.
Case report.
Case report.
Yes.
Case report.
Number 5. In RCT, participants are randomly assigned to treatment or control group. What's the primary advantage of an RCT? A. It is cost-effective and quick. It minimizes the recall bias. It allows random allocation of the participants. It is best choice for rare disease. It doesn't require follow-up.
Random
B.
allocation. Random allocation.
B.
Random
B.
allocation. Random allocation.
Yes.
B.
C is the random allocation for participants is the right option.
Okay.
Number 6. A group of the researchers follow 5,000 people for 20 years to assess the impact of their diet on their heart disease. The type of studies: case control, cross-sectional, cohort, randomized control trial, or quasi-experimental.
Cohort.
Cohort.
Yes,
Yes.
Prospect. Cohort.
yes, cohort is the right answer. Number 7. A newspaper article describes a new syndrome which is found in the patient at a local hospital in a case report. What is the primary weakness of a case report? A. It is high cost. B. It requires large sample size. C. It cannot establish causality. D. It is prone to selection bias. And E. It requires long follow-up.
D. Prone to selection bias.
No casualty. No
No.
casualty.
C option.
Yes, C is the right option. Number 8. Government launched a program in which vaccine is tested by randomly assigning children in different cities to either the vaccine group or placebo group. The study design being uses cohort, RCT, case control, cross-sectional, systematic review.
RCT. RCT.
RCT.
Yes, it's an RCT. Number 9. A researcher analyzes 15 previous studies to determine if wearing mask reduces the spread of COVID-19. What type of study is being conducted? A. Systematic review. B. RCT. C. Cross-sectional. D. Cohort study. Or E. A case control study.
Case control study.
A.
A
Case
option.
control.
No, it's a systematic.
A. Systemic review.
Yes, A is the right option. Number 10. Researchers use hospital records from the past 10 years to determine if long-term exposure to air pollution is linked to respiratory disease. This example is what type of study design? A. Prospective cohort. B. Retrospective. C. Cross-sectional. D. Case control. And E. Randomized control trial.
Case control.
Retrospective
B.
cohort.
B.
Retrospective cohort.
Retrospective.
Yes,
Retrospective cohort.
B.
yes, B. Retrospective cohort is the right option. This is the key of the MCQs. The link to our YouTube channel where the presentations will be uploaded. Thank you.
सर मैं बैंक तक जा रहा हूँ
Thank you.